Brent, can you hear us?
I can now.
Okay, we're going to go ahead and get started. If Kristen ends up turning our video on fine, it's okay with me. If it's not, we'll just be little pictures in the corner anyways, because we've got a PowerPoint presentation here. But
you can start your video. Sorry, I got it.
You got it?
Yes, try.
Do we need, okay, start video.
Sorry.
There we are. Yay.
Oh
welcome everybody. You can now see us. And we appreciate your patience as we work through the technical difficulties. I am Lee Harrison, and I'm VP for Marketing and Enrollment. Brent, you want to introduce yourself?
Yes, my name is Brent Nipper, and I'm the Director of Property and Risk Management here at Milligan. So it's good to be with everybody today. I can't see myself, but maybe you can see me. If not, you can hear me. So.
We just wanted to take some time to kind of go through the response that Milligan has taken so far and what we are planning on. We know that that is obviously a big topic of concern and interest for everyone, and we want to make sure that that is clear for you all and where we're heading. There we go. So with the timeline, just to back up a little bit and walk you through where we've been in this pandemic situation at Milligan. Back mid-March, we were closed for spring break already when a lot of this really started hitting heavy. And so our students were already off campus the week that it really hit. And we decided that week to go ahead and close for an extra week of spring break, followed by 2 weeks of online. But by the end of that, and even before that, we had decided, as many institutions in the country did, that we needed to just close the entire campus for the rest of the semester and finish online. Those are never easy decisions, and there's a lot of thought that goes into those, as well as a lot of planning that has to happen, because a lot of adjustments had to be made by everyone. And our faculty and our staff and our students all rose to the occasion really well. And we had things that we had to work out along the way, but for the most part, it was a pretty smooth process. And our everybody stepped up, and we did a lot of virtual activities in addition to online learning. We tried to keep up the Milligan experience of the student connections and a lot of activities, and we did that fairly well. So a lot of virtual activities. We did have one positive case on campus. An employee tested positive March 26th. At that time, she had not been on campus since March 20th and really had not been around anyone but a few people in her office, because, again, our students had already been off campus for several weeks at that point, fortunately. But we did go ahead and completely empty campus at that point, and went really virtually, most employees working virtually at that point for the next couple months. May 18th, mid-May, we did start to open campuses with limited access, a lot of strict guidelines, and continue to be operating that way very carefully. Most of our summer classes are online. In fact, all of our summer classes are online at this point. We do have a few summer programs, but most of them have been canceled at this point. And so right now, we are in the process of planning for fall. And what does that look like? And so we're going to share a little bit about that for you today. But that's been our timeline so far. Our response team, immediately back in that early March period of time, as all of this started to come about, we immediately formed a response team for this. And it's our typical response team that is part of our emergency crisis management plan here at Milligan. And so that is the president and his cabinet, his senior administration, which is the 5 vice presidents. For the different departments and areas at Milligan. So academics, student development, business and finance, advancement, marketing and enrollment. In addition, our dean of students, our school nurse, and Brent, who's our director of property and risk management, served on that team. And we started meeting every single day, 9 a.m. Meetings at first on campus, but then as we started to social distance and close campus, it moved to Zoom, and probably like many of you, we were on Zoom a lot in the past several months. We had daily meetings. After a couple months, those moved to twice a week, and they continue twice a week as we just help the institution manage this the best way possible. There's been a lot of involvement with resources and partners, and Brent, I think, can discuss this as well, because he's been directly involved in most of these.
Thanks, Lee. We've really been very blessed with the number of resources that we have and the relationships that we have with a lot of really helpful people that have helped us through this. And I won't go down the entire list that you see there, but I'll point out a couple. Ballad Health, as many of you who live in the area knows, by far the largest medical provider in this area of hospitals and doctors' practices and things like that. And several of their representatives actually have Milligan ties. We have some alumni there, and not that they wouldn't have helped us anyway, but it's good to have those relationships. And about 2 weeks ago, we had just a really good meeting with several folks from Ballad, just kind of looking at sort of those practical things that we'll need to consider for going into the fall. And also to get some advice, just to kind of ask them, hey, we're thinking about this, and what do you think about that? And it was really helpful. And that same day, we had that meeting in the morning, and then early part of the morning, and then the latter part of the morning, I was on a webinar with it was with TACUA, which is Tennessee Independent Colleges and Universities Association, and it was actually a webinar that was conducted by someone from the State Department of Health. And those two things, they were both pretty long. It was a pretty full morning, but at that point, I really felt sort of what had previously been more general discussions of what COVID-19 is, what some of the things need to be aware of, and to really kind of specific guidance and advice. And that was really helpful to us to kind of move in that direction. And the folks from Ballad that were part of that were very, very helpful to us. And also a lot of these other areas have really done that. And as we've moved further along, we've gotten into more of the things that have helped us to make more specific plans. I think the next thing we want to talk about is our Milligan Returns Home plan. And as you can see there, our plan is, as it's called, Return Home. Our goal is to get back on campus this fall and to do that in a way that everyone's health and safety is promoted as best we possibly can. I've thought of this several times throughout this process as kind of finding where we fall in the middle of two kind of polar opposites. There's where we were in the spring, which is basically online, the totally online experience, and basically the campus closed down. And then there's where we were at this time last year, or going into the August semester last year, which is basically the way it's been for a long, long time, and everything just kind of going the normal way that it has. And I think our challenge and what we're working towards is to kind of find where we fall in the middle of those two things. And I think it's important for us to realize the importance of both ends of that spectrum. We need to make sure that we're putting safety and health of our students, our faculty, staff, visitors to campus, everybody in the campus community at the top of our minds and our plans. But we also need to recognize that the Milligan experience is unique in a lot of ways. And one of our core values of scholarship, community, and faith is community. So that's a big part of what we're a part of. And we really feel like to be who we are, we need to make every effort to be able to build that community. So we're kind of living in that tension between the two right now. And I think that's been an interesting process for us to walk through. There's obviously a lot of discussions and things that fall into that. But as I've thought about it more, I've kind of also thought about it being a part of the educational process itself. Our students and prospective students, as we have today, and our faculty and staff, we're all learning in this particular circumstance how to live in that tension between those two sort of poles. But at the same time, how much of life is like that? We want to prepare our students for life after college and what it means to live in the world as a Christian servant leader. And there'll be numerous, or maybe can't even count how many times they'll find themselves in situations where they have the two different decisions and finding how to live in that tension between the two. So I think it's hard to find silver linings in this situation, hard to find a lot of positives, but I think that may be something that could come out of it. It's really going to be helpful probably to prepare students for later in life and their careers and ministries and things like that, to have gone through this and sort of walked through this with us. One of the things that we did as a part of Milligan Returns Home, if we could jump back for just a second, we divided into subgroups or sub-teams. And as Lee had mentioned, the response team of a handful of people were really kind of the boots on the ground for a long time, especially in that period of time where it seemed like we were making decisions daily, if not hourly. And it was helpful to have a little bit of a smaller group that could really work together and really sort of commit time and everything else to doing that. But as we got into our fall planning, we realized we really need to broaden that out and into some different areas. So we formed these sub-teams, and each one of these sub-teams has faculty, staff, and student representation. And we're going to run through those. You can see the list of them there, but we'll run through them individually next. And the first one is health and wellness. And as you can see there, that's just sort of the general guidelines that we have. Our campus nurse is heading this up, and there's several other folks on that, faculty and staff. And this is really the sort of procedural things that we'll do as far as prevention and response. And this involves sort of the educational part of things that we'll really promote to people. I'm going to talk just a little bit about that later on, but that's really a critical component. And then the communication to the students of what's available and what they should do in given situations. We do have a counseling center that's a part of this that maybe sometimes doesn't get recognized. It's just the mental problems that can come from living under the strain of this situation. So we've got that. We have a phenomenal campus nurse. The parents out there, I can assure you, sending your son or daughter to college, if you could design the campus nurse that you would want to send your son or daughter to, she's here. Her name's Karen Mahan. She's excellent, both at planning. She has a lot of experience, both at working on this committee and putting these plans together really thoughtfully and carefully, and also just as a real resource of reassurance and comfort to our students. So I can't say enough about that. And that's kind of gives you a little snapshot of what this team is all about. Our next team, academic and instructional technology. And in the COVID era, these two things go hand in hand because they always really have, but now even more so as we've had to move, obviously in the spring, move completely online, and there will probably be some considerations that we need to make going forward into the fall that will have a strong technology component. Some of the things that we're considering, and as we go through these slides, and I probably should have mentioned this off the bat, these are all still works in progress. Just to be perfectly honest, we'll have a lot better, more specific answers to probably a lot of your questions 3 weeks from now. Somewhere along there, the teams are working now, gathering recommendations, and then the response team is going to put together a plan. But some of the things that we may look at are alterations to the academic calendar, maybe breaks and things like that might be different. That's things that you've probably seen a lot of schools have done. We haven't really decided about that yet, but that's you see a couple of plans that we've developed there. And then just the space, we've heard a lot about distancing and the importance of distancing. How are we going to distance our teaching spaces in our classrooms? A lot of our classrooms are pretty large. A lot of our classrooms are really small, and that's one of the things that we really feel strongly about at Milligan is having a very good teacher-to-student ratio. So we may have some classes that it's not an issue, but we do have some larger classes. Figuring out how to space those out and really create that distance that we need. We're looking at screening to make sure that our students, before they come to class, and our faculty and staff, before they come to work, go through that list of things that they need to go through and recognize if there's any symptoms or anything like that they're having that could potentially lead to spread of COVID. We're going to have to be flexible in class and work at class attendance and people come to work. If they do demonstrate symptoms, we're going to err on the side of caution. We're going to say, okay, we're going to provide online resources, work at home for our employees, and students have an opportunity to do some of their work online if they need to not be in class a certain day. And then all the PPE that we've heard about, personal protective equipment, we're looking at all the different options for that we can maybe put in the classrooms or have available to our faculty and to our students to just guarantee, or as much as we can, assure that we're doing things with health and safety as a priority. And then, as I mentioned a little bit about consideration for at-risk, it'd kind of be the same thing. If we need to have some online resources available, we'll do that. And just flexibility is really the key to a lot of these things. And I think you'll see as we go through these slides, flexibility is very important. And there's a lot of flexibility in this plan. And that makes things a little harder sometimes, but that's what we need to do. I think Lee's going to take over for the next few teams.
So Student Life is another team, and of course they're looking at all the guidelines, as Brent has already mentioned, similar types of questions and guidelines that are needed for campus activity gatherings. And there's a lot of different things that come under that. Campus activities, certainly our spiritual formation program, chapel services, intramurals. We're looking definitely at Welcome Week and what that needs to look like. And our goal here, as with all of these, is how can we encourage and provide and facilitate as normal of a college experience as possible to get the Milligan experience, but as safe as possible. And it will be different. It will definitely look a little bit different, but we definitely want to still maintain what is special about the Milligan experience as we go through this. So that will include some different guidelines and some changes to things, some different policies, checklists, and things like that. Athletics is a big one. Our team has been working on this for quite a while. They are in very close coordination with the NAIA, which is our national affiliation, and the Appalachian Athletic Conference, which is our local conference, as well as a lot of different national associations related to college athletics. And they are working on very specific guidelines and plans for each sport. So again, here in the coming weeks, we will have some very specific plans that will be shared and communicated to the student athletes and the families related to that. Residential and food services, we are primarily a residential institution, and about 80% of our traditional undergraduate students do live on campus. And so this is definitely an area of focus as we work on this plan. How do we promote residential health and safety while still, again, maintaining that strong sense of community in the residence halls, as well as in all our food service facilities? So looking at all the guidelines from, all the different entities and organizations that are speaking into this as to what you can do and what you must do for food services. The social distancing, the cleaning, the hygiene practices, all of those things. We're in the process of looking at the seating in the cafeteria and already have some plans in the works for how to spread that out and how to make sure that we provide enough dining facilities, even spread out, and providing the safety. So definitely cleaning, sanitation, and prevention is involved in this. And then finally, our last team is looking at communication. How do we communicate these plans, these details? There's ongoing communication and has been. Over the past several months, we have done several, 1 to 2 times a week. The president has issued updates on the different aspects of our response to the plan, or response to the virus situation. We've done periodic emails to parents, to our different constituency groups, and all of these updates are posted on the milligan.edu/health website. So we really do encourage you to look at that and keep an eye on that. And again, as the plan is finalized and announced in probably early July, it will be shared very publicly and everything will be communicated. So the communication team is really looking at what do we need to do and have in place in order to make sure that the plan is communicated, but then ongoing throughout the fall semester and the year and however long necessary, we have good communication. That's something that's really clear and important to us here at Milligan, is to be as transparent and upfront as possible and quick as possible with communication and information.
I'll talk for just a minute about this Northeast Tennessee region. It occurred to me as we were planning and preparing for this meeting that we probably have folks participating in this meeting from all over the country, maybe even some folks participating internationally. So you may be kind of wanting to know, what has the situation been like in Tennessee, and most specifically in Northeast Tennessee. In the state of Tennessee, as you can see there, 21st in cases, 32nd at deaths. Among the 50 states, we've kind of been on the lower part of that. One thing that we've been on the higher end of is testing. I think our state leaders have done a really good job of promoting testing. So we're 12th in total tests and 9th in test positivity, 9th lowest in test positivity. And one of the things that I've learned throughout this process is that test positivity rate is really important. And if you look at the national average, I think it's somewhere around 9, and Tennessee being around 5, which from what I understand from the experts is about where you want to be, 5 or lower. So I think that's a positive that we can speak to the state of Tennessee. But really more importantly than Tennessee is our region, because if you look at where the Milligan University logo is on that map. And then you look at, say, where Memphis is located. We're a long ways from there. We can basically get to the beach, get to the Atlantic Ocean quicker than we get to Memphis. So what is true for the state is not necessarily always true for our region. And that's certainly been the case for COVID as well. You can see those numbers. The number we want is 0 for any of these things. But if you compare those numbers of cases in the 10 counties of Northeast Tennessee, which is a pretty big area, we have some really large counties. Some of them are not really large in population, but they're large in area. So in those 10, you can see some fairly low numbers. And then just calculating the percentage of cases in Tennessee, less than 1.5% of cases, less than 2.5% of deaths. I think part of the reason for that, our local leaders have done a really good job of promoting health and safety, but also we went under restrictions with the rest of the state of Tennessee. So we went under restrictions when places in Middle and West Tennessee had a high number of cases, had much more, more problems with caring for people. I think they did a good job of taking care of everybody that needed to, but we kind of benefited some from going under some of those restrictions at an earlier point in time when we had many fewer cases. And that's really worked to our benefit, I think, as we have really been able to take advantage of while we didn't like it, we've been able to take advantage of the downtime and people not moving around as much. And that's really caused our total number of cases to be lower. So if anyone was curious about kind of the situation on the ground here, what it's been, hopefully this has been helpful in kind of letting you know about some of that. I did want to talk just a minute about this COVID-19 spread prevention. There's nothing here that you have not heard many, many times before. But the reason I kind of wanted to plug this in here, that we wanted to talk about this is these are the things undoubtedly that we're going to be promoting and asking you to do. There'll probably be other things too, but I really want our students, prospective students and parents to know that these are the things we'll be talking about. I want prospective students to start thinking now about this is part of what college is going to look like. And I think it can still be a great experience. But it's going to be a little different. And the other reason I wanted to focus on these things is that from research and from reading things and talking to experts, and even from some anecdotal experience, I really firmly believe these things work. I really believe if we follow these strategies, we can, at Milligan, in the community, wherever you may be, I think these things really do work, and that these things are going to be important in us being able to do the things that we want to do. But it's also helps us to know that if we do these things, we don't have to shut down like we did in the spring, unless the situation changes, really dramatically. So social distancing, 6 feet distance, hand and face hygiene, the washing of the hands or hand sanitizer, and washing those hands for 20 seconds and singing the ABC or whatever you want to do to make sure you're doing that. Face hygiene, not touching your face. I'll just be totally honest, it's been the hardest thing for me. I never realized how many times I touched my face over the course of a day, but you really have to be intentional about that. And face hygiene could also involve face coverings. We talk a lot about face coverings and how important they are to these efforts. Respiratory etiquette, I love that one. Nobody had ever heard of social distancing before. And respiratory etiquette is just kind of a new term that we hear a lot. It's basically just covering coughs and sneezes. If you look at some of the studies that have been done and even some of the illustrations that people have made for the difference in just speaking or breathing and coughing or sneezing, how much gets spread through those things. And then screening for symptoms and exposure. We're already doing that here with some self-screening for our employees that are on campus this summer. We're going to, I'm sure, be continuing to do that, and we're looking at different ways to do that effectively. But if we have any symptoms at all, we need to not come to work, not go to class. Those kinds of things, really important as well. And sometimes that's erring on the side of caution, because whatever the symptoms that we're having may have absolutely no, but probably don't have anything to do with COVID-19. But we do it anyway because that's helping the larger effort. And then cleaning, disinfecting, we're looking at a lot of different options for that. It's really important. We're going to be encouraging our students to really clean. We always do, clean the dorm rooms, clean their dorm bathrooms and things like that. But we're really going to be pushing that as well. And again, I just kind of wanted to throw this out here as a reminder and to really encourage our parents and students to be talking about these things in preparation for coming to school, and just again reiterate that I really do think these things work, and if we can make these a big part of our lives, we'll be really giving ourselves a big foot forward in being able to successfully get back together. See, our next one is just a recap of the Milligan Returns Home. Again, we'll just leave that up for a minute so you can see what those different teams are, if you need a reminder of that, and kind of where we are right now. And again, much more information will be forthcoming. So hopefully allowed some good time for Q&A. And if you want to I think Kristen maybe is going to give us the questions, and Lee or I will do our best to answer.
Yeah, I think the first question that's been posed is how social distancing will be accomplished in the res halls with roommates.
I can take that one. That's another one of those things we're working through. It'll probably be, without knowing the specific details of the plan, it'll probably be sort of like that you made within your home. Distancing within your room or suite will probably be difficult to keep us 6 feet at all times. Other strategies could be the placement of the beds in the room to where they're spread out further, and maybe your head of one is on one corner and the head of the other one's another corner. The different strategies, things like that. I have a daughter who's in college as well, and one of the things that I noticed in looking at schools is, especially in the dorms that all of our freshmen will be living in, most likely, they're older buildings, but they have really large rooms. So I think that's going to be a real advantage. Some of you that haven't visited Milligan and seen some of these rooms that may have been in some other schools, I was surprised at how small rooms were in some of the other schools compared to ours. So there will be some strategies for doing that, but I think we also probably need to be realistic that the roommates and suite mates will probably be very similar to a family unit that you might have in your homes right now.
The next questions deal with mask wearing. Will students be encouraged or required to wear masks in the fall?
I think either one of us can speak to that. Certainly under current guidelines, that is the thinking that they will be, but we will be continuing to monitor whatever the CDC and state guidelines are on that. And so again, as the plan rolls out, it probably will include mask wearing, but that perhaps may change by the time fall semester starts. Brent, do you have anything else on that?
Yeah, that's again one of those things that we are working through. I think we'll have much more clarity on that, on mask wearing and when and where. That'll be really important and required as we kind of bring all of our groups back together. Probably all of our different teams have looked at how that impacts their particular areas, as well as our health and safety team looking at an overall picture. So probably not the answer that you want to hear, but I think we'll have much better clarification on that within a relatively short period of time.
And we will communicate, certainly. Again, it'll be part of the plan, but if there are changes between when the plan is issued and the start of fall, as Brent said, a lot of this flexibility is going to be important. And so as any updates occur, we will be communicating and notifying everyone of that. And we will let you know for sure what PPE would be necessary and important for you to bring with you in the fall.
Question regarding the academic calendar. If we go with the plan where we finish up in person before Thanksgiving or even online after Thanksgiving, what about the start date for classes? Do we think that will remain consistent or perhaps bumped up?
As of right now, the goal is to keep the start date in the entire semester calendar that's currently published. The goal is to keep that the same. So as of right now, yes, the start date for the start of the semester and the end of the semester will be the same. But again, there's a lot of different considerations in that, so we have to have some different plans and some different contingencies for that. But currently, it is the same.
I don't want to get myself in trouble and speculate too much, but from what I've seen, I'm on the academic and instructional technology team. From what I've seen, the start date changing is pretty unlikely. Again, I don't want to commit to anything and then be proven wrong, but schedule changes later in the semester may be possible, although that's not our goal. At this point, I would be very surprised if there is a change in the start date, but just with the caveat that things do change, and we may, someone may come up with a great idea that would accomplish a lot more things that we're trying to accomplish, and have that be a part of it. But I think it's unlikely.
We have a question about cleaning supplies being provided or bringing them.
For our residential students, we would ask them to bring cleaning supplies. I think that's probably on the list of things that the dorm, the residence life team puts out. We will have hand sanitizer and cleaning supplies in all the common areas and classrooms and inside, as you walk inside buildings and things like that. But unless there's some plans being made that I'm unaware of, I think for the actual in the dorm room, that we would expect the students to bring supplies for that.
Last question for right now is if athletic practices will have any changes due to social distancing.
Brent, you want to take that, or you want me to?
Sure. I would say yes, they probably will.
They will.
I just have a hard time imagining how we would accomplish the things that we're trying to accomplish without having some of that. Now, we have a lot of really good coaches that have a lot of experience, and I think they can put together a plan that will keep that athletic experience, that team experience together as best they possibly can. But there may be some things that are a little different about going to practice and locker rooms and team meetings and things like that. That may be a little different than they might have been if we weren't in this situation. But the intent will always be to keep the teams together and participating and competing in as close to normal fashion as possible.
And we will be following the guidelines that the National Association and our conference both provide, and a lot of that is definitely in discussion. And already we know that they probably will be doing temperature checks before all practices and things like that. So a lot of that, like Brent said, is definitely in current planning and will be part of upcoming plans that are announced.
We have some questions about athletics. One from an athlete perspective, if students do not generally return to campus after Thanksgiving, will athletes have to stay to play their basketball games or games that are finishing out the season?
If the NAIA and the conference decides to continue the schedule for those sports, then we will follow, more than likely, we will follow those guidelines as we did this spring. And they fairly quickly, just as the NCAA did as well, made decisions to make some changes to schedules and eventually pretty much cancels seasons. But basically, we'll be following that guideline. So more than likely, if it is severe enough that we decide not to come back after Thanksgiving, again, I don't want to make assumptions, but more than likely those sports probably would not be continuing, but I don't know that, and we'll just have to wait and see. But that'll also be that is part of what the athletic committee is looking into.
Yeah. The last question right now is athletic events, can they be attended?
I don't think we don't currently know that yet. And Brent, I don't know if you can speak more to this, but I think that's again part of what the athletic team, athletic sub team is looking into, as well as the associations. Brent, do you have any more on that?
Yeah, I haven't really been a part of conversations about that. I will say that to a certain extent, the calendar works in our favor, as a lot of our early sports are outdoor sports. And also, sometimes it's good to be a little smaller. We don't have Neyland Stadium that has 100,000, 90-some thousand, 100,000 capacity. We don't have as large a crowds. So if it's possible to do distancing and things like that and have people attend events, I think that we'll be in a much better position to do that than maybe some larger schools would be. So I'm sure that the intent is to allow some sort of spectating at the games, maybe at the beginning limiting it to students and families or something like that. But again, that's just total speculation on my part. But And again, if the NAIA comes around, or the conference comes around and says this is what we're going to do, then that's what we'll do. But I feel like Milligan has got a good chance to be able to do some of that as just about anybody safely.
Yeah. Another really great question: if athletic seasons are not allowed to resume or are delayed, what will the status of athletic scholarships be?
If the decision is made institutionally that seasons cannot continue, athletic scholarships would still be honored. We did that this spring, and that would still be the case for this coming year as well.
Great. No waiting questions right now. If anyone has a few last questions, feel free to type them in the Q&A.
Yeah.
Well, as we're waiting for questions, I just want to thank everybody for allowing us to come talk to you all. I think it's been beneficial to us. Our contact information is there, and you can find it probably pretty easily on the website too. If you do have questions, I'm sure Dr. Harrison and I would be happy to follow up with you on those things. And I end pretty much every talk that I have with students the same way, and so some of the students there will probably hear this again at least more than one or two times. But what I do here at Milligan, what Dr. Harrison does here, what everybody pretty much up to the president does here, is really focused on allowing students the opportunity to be successful. We want you to be successful. We want to do everything we can to make you successful. And we're not going to take tests for you. And honestly, in most areas, you wouldn't want me taking tests for you. And we're going to have expectations. We have standards and expectations that we're going to ask you to meet. But short of that, that's why we're here. We believe in the mission of the school. We believe in you. We're here to make you successful. And that extends even further into this planning time that we have right now. And that's first and foremost on all of our minds, is what can we do to provide the best experience and the best opportunity for success while at the same time keeping everybody safe. So that's why we're here. Hopefully that's part of the reason you're choosing Milligan, parents, you're choosing to send your students here. And if that provides any reassurance whatsoever, I can assure you that everybody that I work with here feels strongly the same way.
We encourage you to take a look at the website as it is updated every week with updates, and certainly as these plans are finalized, again, there's certainly still some unknowns, but as the plans for fall are finalized, we will be sharing and communicating those quite extensively. And then know that, again, there will probably continue to be some adjustments and changes as we monitor conditions, follow CDC, state, and other guidelines, and make the necessary adjustments. So we will hear more from us in the coming weeks and months for sure.
Great. Well, no more questions, so go ahead and sign off.
Okay. Thank you all.
We'll see you after the lunch break.
Bye-bye.